Hi, my name is Sammy, and today I'm going to teach you how to administer oral medication. So the first thing you're going to want to do is gather all your equipment. So you're going to need your doctor's orders, you're going to need the medication, you're going to need a cup for the medication. So either you can get a little medication cup or just a paper cup, and then you're going to need some water for the patient. So I'm going to go ahead and wash my hands. And I'm going to do my first medication check against the provider order. So I'm going to grab my medication and look at it. It looks like acetaminophen, 500 milligrams. So that is also what's on the order. So those match. You're going to want to also check the expiration date and the lot number. And then if you were to need to do any drug calculations, you would do that now. But since the provider order is the same as the medication, you don't have to do anything. You're also going to check the 6 patient rights, so the right medication, the right dose, right route, right time, right patient, and right documentation. So the first thing you're going to do is grab the medication, open that up, and pour it into the cap. Once you have that in the cap, you're going to go ahead and take the cup and put it in there, because you're never going to want to touch the medication. The inside of the bottle and the cap are not full of bacteria, so those are okay for the medication to be in, and the cup will be clean as well, so you're not physically touching the medication with your hand. You can go ahead and put the cap back on. And then you're going to want to do the second medication check. So again, checking like the expiration date, checking against the order, making sure it's the same, looks like it's correct. So then you're going to take your medication bottle, the order, and then your water into the patient's room. So once you're in the room, you're going to want to identify the patient, introduce yourself, and explain the procedure. So I'd say, hi, I'm Sammy, I'm your medical assistant. Can I get your last name and date of birth? So the doctor ordered for you to get your acetaminophen medication today. Is that okay if we give that to you? All right, so do you have any allergies to acetaminophen? Okay, and then at this time I would provide education on that as well. And before giving it to the patient, I'm going to do my third medication check. So again, checking the medication to the order, the expiration date, making sure that's all good. And then I'm going to go ahead and give the medication to the patient. And I can go ahead and give them the water as well to wash that down. And then once they have taken that medication, I'm going to wash my hands again. And then I'm going to document that into the patient's chart.